Hello APSNA members and colleagues. Greetings from Miami. My name is Raquel Pasron and I am the current president of the American Pediatric Surgical Nurses Association. Before we get started, I want to thank you for taking the time to click on this video or read the attached announcement. We appreciate how busy you are as a nurse caring for pediatric surgical patients. Thank you for taking the time to review this update. I would like to tell you about the last 18 months of work related to the APSNA strategic plan. The release of the Institute of Medicine's report, The Future of Nursing, Leading Change, Advancing Health, makes this an unparalleled time in healthcare and nursing. Anticipated changes in nursing practice, education, recognition, and other aspects of nursing are mandates that have opened a rare opportunity for the estimated 3 million nurses in the United States to act urgently before the focus shifts to other initiatives and programs. The IOM committee delivered 4 key messages. Number 1, nurses should practice to the full extent of their education and training. Number 2, nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. Number 3, nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. And number 4, effective workforce planning and policy making require better data collection and improved information infrastructure. The report clearly urges nurses to assume primary responsibility for personal and professional growth in continued individual lifelong learning and opportunities to develop and advance leadership skills. Nurses are challenged to be transformative leaders in collaborative and interdisciplinary environments, whilst being fully engaged in healthcare decision-making on a public, private, and governmental level. This will require competent, educated leaders that are powerful collaborators while holding key positions through membership on boards and governance bodies. The report makes a plea to nursing specialty organizations, such as the American Pediatric Surgical Nurses Association, in regards to their relationships and interactions within. The report further demands that in order for the advancement of collaboration and syntheses in evidence-based policy that affects quality healthcare and service delivery, specific competencies need to be developed and sustained. Nursing and its leaders need to demonstrate the political and professional maturity to negotiate the complex healthcare milieu and assert the profession's legitimate role in decisions and actions. A critical analysis of organizational infrastructure and a vision for transformational leadership are starting points to tackle the charge given to us in this endeavor. Knowing well that change is inevitable, our consumers, patients, families, colleagues, administrators, educators, to name a few, want more healthcare information and services for their healthcare dollar. The current and anticipated healthcare milieu changes are opportunities to not only lead this transformation, but advance healthcare for our patients and families. APSNA decided that we would adopt the 4 key messages of the IOM Future of Nursing Call to Action and align them to the APSNA strategic plan. The journey began in the summer of 2014 and was completed this fall in Orlando, Florida. The strategic plan is a major document that guides APSNA's future. The plan is based on our bylaws, mission and vision statement, values and goals. The strategic plan is developed by the Board of Directors, reviewed annually, and updated every 3 years. A planning committee comprised of Neil Eade, Chris McKenna, Letitia DeYoung, Janice Dudley, and myself used Bryson to guide our process. This process involved a review of the organization's mission and vision statements, values, guiding principles, assumptions, membership surveys, and strategic planning questionnaire, membership data, committee, advisory, and special interest group reports, strengths, weaknesses, opportunities, and challenges, and budget allocation, communication, and implementation strategies. This review process was followed by an action plan developed by the 2015-2016 Board of Directors, which includes goals, objectives, budget implications and/or resources, measures of success, timeline and progress, or outcome data. Checkpoints to review and address progress will include quarterly reports, board meetings, and annual reports by all involved parties. Please download the attached strategic plan and review how the 4 key messages from the IOM Future of Nursing report align this initiative to the APSNA 2015-2018 strategic direction. As you read and review the strategic plan, take the time to identify how you want to be involved. As a specialty organization, our vision and purpose requires faithful pursuit of the organization's mission. Understanding this and recognizing that singular positions or solutions do not address the complexity that the future of nursing holds for us is vital. The IOM report is a perfect and sound structural basis for strategic planning. As APSNA leaders, we must ensure that pediatric surgical nursing experts and APSNA members are steered to redesigning healthcare systems. Moreover, we must empower the membership to take this challenge and value it. This is the legacy that our current and past leaders must ensure for our future. Opportunities will exist for you to take this challenge and boldly step forward. I encourage you to share your expertise and knowledge with families, stakeholders, students, work groups, communication mediums, and policymakers. We welcome you to become re-energized by being involved with APSNA as we embark on this journey. Together, we can make a difference. As the APSNA Board of Directors know, we are one heart. Thank you so much for your time and attention. Please feel free to contact me. If you have any questions, we welcome your comments and feedback.